Hello and welcome to the Robin Midgley Mentoring Mondays YouTube channel. This session follows on from last week, the 20th of June, 2022, where I presented Contessa Stewart's patient, Christy. So if you recall, this is a 34-year-old patient who slipped on wet concrete and she sustained a laceration to zone 6 of her right hand and required a repair to the FCU, to the ulnar nerve, to the FDS and FDP of the ring finger and FDP of the little finger and the middle finger. So she attended multiple hand therapy sessions from December to March of this year, and treatment included a dorsal block orthosis followed by the tendon protocol, as well as a variety of orthoses. She had otiform, she had all kinds of scar treatment and massage and traditional therapy, but after 17 sessions, she had no improvement and presented with a claw deformity. So what we would like to show you today is how you can use the SIMS technique to improve a claw deformity in only 2.5 weeks. So after 17 therapy sessions, we corrected the claw deformity in 2.5 weeks. So we all use anti-claw orthoses to treat claw deformities. But what we're advocating is that you use the SIMS technique using plaster of Paris only. Why would this be of benefit? Well, for 3 reasons. The first is that you would be providing a non-removable circumferential cast that positions the joints adequately to move, and you will get a constant cyclical repetitive motion within the desired range. Secondly, you will be impacting the scar tissue because you are providing a pseudo massage to the scar tissue surrounding the nerve. And thirdly, because you're actually improving the somatosensory cortex of the brain. So as the patient relearns that normal pattern of movement, using and recruiting the correct muscles in the correct way, you will have a long-term effect. When working with a patient with an ulnar nerve lesion, you can use the SIMS technique quite effectively if you allow the patient to focus on FDP and FDS separately. So we do this by giving the patient 2 different cast designs, and they wear it with a ratio of 70 to 30%. So 70% of the time, the patient is focusing on the FDP recruitment, and 30% of the time, they're focusing on FDS. And it is quite incredible to see, particularly in this case, how Christy was able to focus her attention first on FDP and then FDS and start to recruit the correct muscles by impacting the somatosensory cortex through connecting her brain with her hand during motion. So in only 2.5 weeks, we fully resolved the claw deformity, and this was a permanent effect. This case study demonstrates to us how we can use the SIMS technique to resolve a claw deformity, which in effect is an ulnar nerve lesion, in a relatively short space of time. We managed to achieve an excellent result in only 2.5 weeks versus 17 weeks of traditional therapy. Patient still needed some more time to achieve an even better result, and we will still continue with some other traditional therapy techniques, which we will share with you in due course. But ultimately, the message is Just because a patient has a nerve lesion doesn't mean that the deformity is permanent, and it doesn't mean that the patient needs extended therapy over a long period of time to try and achieve a result, or tell the patient that they will not achieve a result because of a nerve lesion. So we hope that you enjoyed the session, and we look forward to seeing you next week.